Hey guys, I'm John Kwan and this is Christy Warner. We're doctors of physical therapy at Core Performance PT, and today's segment is on the chin tuck series. Now, why is the chin tuck important? Well, most people, if you watch them from the side, they have this forward head posture, right? We sit behind the computer, we're on laptops or on our iPhones, our head is always forward. This is an epidemic. We need to fix it. So this exercise is going to be a game changer. Help strengthen those deep neck flexors, keep your head above your shoulders so that you not only look confident, but you look good and you're going to prevent injury. All right, so Christy's going to demonstrate. First part is we're going to have a little towel roll that's rolled up. It's going to be put on the back of her head. There you go. And nice relaxed position, supine position, knees are bent, okay? Again, breathing is very important. As always, you don't want to hold in that tension. And what Christy wants to do is she wants to just gently, ever so slightly, pull that chin down into the floor, almost like she's pulling her chin to her ears, okay? Important thing with this movement is you do not want to feel strain. It needs to be controlled, okay? And as you pull your chin back, as you retract your chin back, you should feel a subtle stretch right around the base of your skull where your suboccipitals are, because they are lengthening while you're strengthening those deep neck flexors. Another thing to really point out is that you don't want your front muscles, your SCM muscles, to do this. You don't want them to engage or override the deep neck flexors. So you can palpate, put your hands next to your neck, and making sure that these muscles are not overriding the movement. Now, your deep neck flexors are a posture muscle, they're an endurance muscle, so we want you to be able to hold it for a longer time period. Start off with 5 seconds, progress to 10 or 20, whatever you can do. Most importantly, you want to feel like you are in a nice upright position, even when she's lying down. Good. Now, a progression of that is to maintain that chin tuck. And then what she's going to do is to throw her muscles off. She's going to activate upper body movement, and then she's also going to activate lower body movement. Okay? An important thing to do here is also try to engage your transverse abdominis muscle. Notice how she has a nice neutral spine position. Her back is not arched, nor is it flat on the ground. And she's controlling that movement nice and slowly, controlled isometrically to really stabilize those muscles. Good. Now, progression of that would be to perform that gentle chin tuck. Good, and holding it, she's gonna lift her head up off the ground, holding it for like 5 seconds or longer, whatever you can do, and gently lowering down. Very important to control the movement. Don't jerk up, slowly rise up, slowly lower down. Most importantly, you wanna feel those muscles engaging without causing pain. Good, that looks great. Good. Now, progression of that would be to turn her into a prone position on her stomach. And the hand position is kind of like you're playing hide and go seek, right? Elbows are flared out. Your head is resting on your chin. Good. And she's going to engage her shoulder blade muscle. She's going to pull it down. That's going to engage her lower trapezius muscle. As she's doing that, she's going to elevate her head, going into that, chin tuck position, activating those deep neck flexor muscles and bringing it down. Again, the longer you hold it isometrically, the harder it is. In this position, she's going against gravity, so it's obviously more challenging. And lowering it down. Look, she's demonstrating really good control. She's breathing. Her scapula is engaged. This is a very important aspect of the exercise because this will alleviate tension of her upper trapezius, compensating from the movement along with her SCM. Great. Now the natural progression is to get into more of a quadruped position. Be careful if you have bad knees. You can always put a pillow or something soft underneath your knees, but notice her knees are right underneath her hips. Hands are right underneath her shoulders. Her shoulder blades are down and protracted and nice and stable there. And again, she's utilizing those deep neck flexor muscles, pushing against gravity, not compensating through the upper trapezius or the SCM muscles, and feeling that nice deep contraction. And then the next phase would be to utilize a TheraBand. So if you don't have a TheraBand at home, you can get one from one of our offices or order it off of Amazon. But the TheraBand resistance, again, just adds more resistance. She's not only pushing against gravity, but she's pushing against the resistance of the band, and how you hold it will determine the level of resistance. So figure out a resistance that's comfortable, that's engaging, so you can feel those muscles working without feeling any accessory pain or discomfort anywhere else. Also activating her transverse abdominal muscles for proper stabilization through her lower spine. Great exercise, highly recommend you do it. You can do it even, sitting up while you're driving or working on the computer, okay? But these muscles are very essential into creating that nice upright posture that we all want.
The best way to think about it when you're sitting is like a chicken movement. So a lot of people think chin tucking is bringing their chin towards their chest, but it's actually this movement. So it's almost like a chicken. So like John just said, use the back of the seat rest when you're driving, and you can bring that head into that seat rest and hold. And there you go.
Yeah. And you can also bob your head to the music of the car.